Today I will be discussing a commonly seen postural distortion pattern known as pronation distortion pattern of the lower limbs. This is characterized by a knee valgus or adduction of the knees, as well as internal rotation and pronation of the feet. This distortion pattern affects muscles leading up from the ankles all the way to the lumbopelvic hip complex. This alters proper kinetic chain function of the lower limbs and affects movements such as walking, running, or athletic activities in everyday life. The following are two self-myofascial release and two static stretching techniques that will affect muscles that are commonly tight or overactive in this postural distortion pattern. The first self-myofascial release exercise we will be doing is an adductor roll. For this, you'll need your one foam roll. You're going to place yourself on your side, and the foam roll is going to go on the inside of your chosen leg to roll the adductors. You can control the amount of pressure you have on your selected muscle through the amount of pressure put into your hands. From here, we're going to roll side to side along your adductors, either stopping and holding to release a certain tight spot, or slowly moving along the muscle, rolling it in its entire length. Safety precautions for this particular exercise: make sure to avoid your knee joint and your hip joint, as there are lots of soft tissues that could be damaged if you roll them too vigorously. And also make sure to maintain a neutral spine when rolling on the roller to prevent an arch in your back. You can do this by gently drawing in your belly button to your spine to engage your inner core. Our second myofascial release exercise is to release the biceps femoris or lateral hamstring that often gets tight or overactive in this distortion pattern. So we're going to place a lacrosse ball on the lateral side of our hamstring, so just underneath where your glutes meet the middle part of your leg. And it's better if you find a seated position so that we can lever our leg more efficiently. So placing the ball on the lateral side of our leg, finding a comfortable seated position, maintaining a neutral spine, going to find a tender spot and hold for about 30 seconds. From here, we're going to extend and flex our knee so that we can involve the biceps femoris itself and get a little bit deeper into the self-myofascial release. Once the spot has released, you can move down the leg slightly, find a new position, and begin again, staying on the outside of the leg, but making sure not to go on the complete lateral side of the thigh, which is our IT band. We don't want to roll that, as well as avoiding our knee. So stopping at about 2 to 3 inches above your knee joint so that we don't harm the soft tissues in that area. If you feel excessive pain or too much discomfort, stop or pour more pressure into your hands so less pressure is put into the lacrosse ball itself. Our next static stretch targets the perineals or fibularis complex muscles on the lateral side of our lower leg. To do this stretch, we are going to cross one leg over the opposite knee, and from here we are going to invert our foot by placing our hand on the outside of our ankle, rotating the ankle in, and then pulling it up gently towards our chest. In this position, the outside of our leg is extended or stretched, and we can feel slight discomfort or pulling on the outside of our leg. But if it's too much, release your ankle and try again. We're going to hold this stretch for about 30 seconds, and we're going to perform it twice or for 2 sets. So the perineal ankle inversion stretch. The last static stretch we will be performing is an adductor stretch. This is called the single leg kneeling adductor stretch. For this stretch, we are going to be kneeling on one leg, while the other leg is going to be extended laterally. So for this stretch, we want to make sure your toes are pointed forward or your ankle is flexed. From here, we are going to lower into the stretch, lowering my body down until I feel a sensation on the inner part of my leg. From here, we're going to hold for about 30 seconds, breathing in the stretch, and perform for 1 to 2 sets. In this position, It might feel comfortable for you to put a pad or a towel underneath this knee to prevent excess friction or pressure. As well, we want to make sure that we are not hyperextending the extended knee. So keep a little bit of bend in the knee at all times so that we don't force that joint into an uncomfortable position.